This is Keenan, our son, who has cystic fibrosis, and this is Sydney, his older sister, our daughter, who does not have cystic fibrosis. And today we thought we'd share with you a little bit about our story and also things that we thought might be helpful as we do physical therapy. That's your book. So we found out that Keenan had cystic fibrosis after initially getting his newborn screen back positive when he was about a week old. And then after that we had the sweat test done, which confirmed that he had cystic fibrosis. And as many of you may realize now, we didn't have a family history of it, so it was a big surprise to my husband and I that we had a son who turned out to be someone with cystic fibrosis. But the good news is there's lots happening today with the Cystic Fibrosis Foundation, and the life expectancy is increasing each year, and we were told by our doctor that Keenan should live a happy, full life and should be growing up to be healthy with all that's out there today for treatment. So today we're going to spend some time showing you what we do as we do physical therapy with our active toddler and some tips that might be helpful to you as you're getting started learning to do physical therapy. What we worried about when we first started was, number one, are we going to be hurting him, and what's the way to make him accept this without it being something he'd resent later, because we know this is a lifetime treatment. And then number two, were we going to do anything that would hurt ourselves, because it is quite a physical process and you have to figure out a way to make yourself comfortable while you're doing it so that you don't have overuse of your wrists and hands and then your back and legs and everything else. So we'll do a little PT. We've got his shirt off because we figured as a infant it's actually easier to get a good contact with his chest with the percussor by having his shirt off. And then the third thing we worried about was whether we would have any help to do what we are doing with him, because it seems like it would be hard to teach someone. But we're here to assure you that we actually have been able to train our nanny to help take care of doing physical therapy, and it's possible for you to also train babysitters or family to also do the same. The family can definitely help do PT. So what we were told is that we need to do PT on each segment. There's the 2 segments on the back, the 2 segments on the front, the 2 halves, and then the 2 sides, so 6 segments. And ideally, doing this while he sits up for a minute on the back, sits up for a minute on the front, and then lay him down. Toddlers don't always cooperate, and it's not a perfect session every time, so I'll show you some things that we do to make it easier. Let's see, we got a ball, we have our toys, and we stop when he gets fussy, and then we start again so that he doesn't get mad for a longer time with us. Okay. Instead of doing a constant drum, I actually alternate the beat so that my arms don't get as tired. The other thing we found that helps is to do 2 hands instead of 1, because it shortens it by half the time. It takes some getting used to with your less dominant hand, but you can get the hang of it pretty quickly.